My disease is over alpha-1 antitrypsin deficiency, which is a genetic disorder that manifests as emphysema, liver cirrhosis, and panniculitis. But panniculitis is very rare. It's lumps under the skin, but it's very rare with this deficiency. Alpha-1 antitrypsin deficiency, or A1AD for short, causes defective production of the alpha-1 antitrypsin, leading to decreased alpha-1 antitrypsin protein activity in the blood and lungs, and hyperabnormal alpha-1 antitrypsin protein in the liver. A1AD is a metabolic disorder that predisposes the affected individual to chronic pulmonary disease. Mutations in the coding sequence of the serine protease inhibitor alpha-1 antitrypsin prevents its threats from the hepatocyte. Alpha-1 can be passed down from generations and through families. If your child inherits one abnormal gene from one parent and a normal gene from another parent, the child will be just a carrier of the deficiency. But if the child inherits both traits from both parents, the child will have alpha-1 antitrypsin deficiency. A1AD is produced in the liver and released in the blood to protect the lungs from attack by the enzyme, which is called neutrophil elastase. Neutrophil elastase is produced by white blood cells that is a response to letting the body know that there's infection in the lungs. Signs and symptoms of alpha-1 antitrypsin deficiency is shortness of breath, wheezing, emphysema, asthma, and bronchitis. So sometimes if you go to the doctor and you're having these symptoms, the disease is also misdiagnosed for COPD. So if you're having these symptoms, then you need to be diagnosed for this disease as well, because the disease is also misdiagnosed. The doctors test for this disease by doing chest x-rays, pulmonary lung function tests, lung volume measurements, and they also test for the deficiency by doing a blood sample. Treatment for this deficiency is very expensive. Augmentation therapy is expensive, but it's not appropriate for patients that have liver infected patients. Stem cell therapy is also considered, and further treatment would be a liver transplantation. Also, if you smoke, smoking can be a hazard to patients with alpha-1 antitrypsin deficiency. Smoking increases development of emphysema and asthma and bronchitis. Now, these are different pictures of the alpha-1 antitrypsin deficiency. This is an infected lung. This is also an infected lung after the disease has gotten bad. These are different tests. This is a chest x-ray checking the patient to see if they do have the deficiency. This is a microscope slide of alpha-1 antitrypsin deficiency. This is a microscope slide of the liver that has the alpha-1 antitrypsin deficiency. This is a structure of the deficiency. This is a strand of the alpha-1 antitrypsin deficiency. This is a microscope slide. And this is the liver also infected with alpha-1 antitrypsin deficiency. This is also a liver slide. These are different livers. This is liver after it's been infected, and basically they would need a liver transplantation if your liver looks like that after alpha-1 antitrypsin deficiency. These are all just slides. This is a corrected genetic defect of the alpha-1 antitrypsin deficiency. These are just different genetic codes of when they're trying to correct the deficiency. Alpha-1 antitrypsin Trypsin deficiency is not a rare disease, but it's rarely diagnosed.